Dr. Mauro is a neuropediatrician from Rio de Janeiro in Brazil. He is the medical director of the first public school clinic for autistic children in Rio de Janeiro. He is also the founder of the Institute for the Study of Autism, and he has successfully treated more than 50 children with a CBD oil. He is also a certified nutrologist and a member of several international associations. You can check his bio and more information on Dr. Mauro on our website. And now we will go live with Dr. Mauro that will talk more with us about his experience with cannabis and autism. Dr. Mauro, thank you.
Okay, you are very welcome, Laura. Good afternoon, everyone. I hope you are all safe and healthy during these very hard times, and I hope we can overcome that soon. So I'm going to talk today about my experience in treating autistic individuals, not really autism, but basically behavior issues for some of these families. And when treating those behavior symptoms, we also found some other improvements like in communication, interaction, and sleep quite a few times, but let's go. So talking about cannabis and autism, as I was introduced, I'm a pediatric neurologist. I have about 30 years of practice in pediatrics and pediatric neurology. This is my basic association now with some international societies and associations. We can go that really fast. So, and when we are talking in medicine, and especially about autism, and especially about cannabis, we have to keep some things in mind, is that we are in the learning process. We don't have answers to all the questions, but I hope you have some questions after my talk. And we have no truths, as many things in medicine. So these sentences are just reminders that we have to be humble when talking about knowledge in autism and cannabis, and especially when we make the connections of things that we are still studying, such as autism and cannabis for treatment. So, as you all know, autism is on the rise. Some people say it's an epidemic. Some people say the rise in number of diagnoses is because now diagnosis is more available, so people are more conscious with all the campaigns, but this is controversial. We are not going through this today. But being in 30 years in hospitals and ambulatory care and clinics, I used to see very few children with autism, and I'm sure I wouldn't miss the diagnosis. And now we have new patients now every day, dozens by week. So it's scary for some individuals because they present with many difficulties. Not all autistic patients do well in terms of behavior and communication. Some are very severe, some are gifted, but that's not the rule, right? So numbers are going crazy, as you can see. So in 2018, the estimate of prevalence was 1 in 40 children and teenagers, published in very prestigious medical magazines. So, and we have to keep in mind that 2018, and if you have children diagnosed with they were 3 years old, it means that they were born in 2015. So that's the estimate for people born in 2015. It's 5 years ago, right? So sometimes the studies also see the prevalence in a cohort of 8-year-old children. So we have to keep in mind that they were born 8 years ago. So what we have now for children who are, just born, newborn babies and toddlers and infants, we don't know yet. So we need more treatment, more study, and sometimes more measures just to relieve symptoms and to improve the child or teenager's life and the family life as well, while we have those perfect studies that everyone wants to have. So this is not exclusive of US statistics or Brazilian statistics. This is worldwide. So this is from 2011 in South Korea. It's a very high prevalence. So just a brief introduction for those who are not familiar. Autism spectrum disorder has to do with difficulty in communication and interaction with other people, restricted interests and repetitive behaviors, and symptoms that affect the person's ability to function in school, work, and other areas of life. So it's a spectrum disorder because, as I mentioned previously, there's a wide variation in type and severity of symptoms that those individuals experience. Several factors may influence the development of autism, and sometimes it has also, in the clinical setting, in the context of that individual, sensory sensitivities and medical issues such as gastrointestinal disorders, seizures, sleep disorders, as well as other mental health challenges as anxiety, depression, and attention issues. So some individuals are more prone to mental or to psychiatric comorbidities than others, some more to neurological comorbidities such as epilepsy than others, and some also to gastrointestinal disorders with a diarrhea or a constipation and bloating and difficult digesting foods. So if you don't address these issues, these children or teenagers will have difficulty with the treatments. Basically, things will not work as they should if you don't address these other comorbidities. This is basic, but some people forget it. So problem behavior is common in autistic spectrum disorder. It's very difficult for families. We can only imagine, we never know, only a family who is experienced those behavior issues every day, every night, every year. So they know what kind of suffering is associated with that. And they also know how difficult it is to treat those conditions, even with medications, because medications used for those behaviors, they generally come with side effects, and some side effects can be serious enough to stop the treatment. So the treatment has to be changed to another drug that maybe will cause bad side effects as well. So the problem behaviors vary, but besides the problems with communication, which is part of the diagnosis, they also have anxiety, hyperactive, and problem behaviors such as tantrums, meltdowns, aggression, and self-injury. So I'm going to talk about later my experience with aggression and self-injury. So problem behavior is not a core symptom of autism. So it's not necessary to make the diagnosis. Diagnosis has to do with repetitive behaviors, sensory issues, communication and language, but not necessarily with a problem behavior, although they are very common. And they can be a result of those deficits in social communication, the restricted interests, so they're hard to break. So that makes the child angry and irritable, and sometimes they don't communicate, so they start aggression or self-aggression. They throw objects because they cannot express what they want and what they are feeling at that moment. Also hyper or hyposensitive to environmental stimuli. So sometimes, as most of you know, noise that are not disturbing you and me, but can be a very serious disturbance to some autistic individuals. Also some colors, textures, and so when they anticipate they are going to be exposed to those kinds of stimuli, they don't want to go out, they don't want to leave the home, so they start an argument when they are verbal, or they start to become very aggressive or self-aggressive because they expect they are going, they don't know exactly where they are going, they think they are going to some kind of environment where there's going to be screaming or loud noises and things that will harm them. So they do whatever they can not to go. So kinds of topographies of aggression and kinds of aggression: biting, kicking, hitting, scratching, headbutting, hair pulling. This is the introduction about autism. So, and I've been dealing with children with behavioral issues for almost 30 years, as I told you. We tried different kinds of medications. And years ago, during an event in the US, I was talking to some mothers that they had experience with cannabis and cannabis oil and CBD, and they started to tell me very interesting results. So it was new to me, although I knew the literature about epilepsy, but literature about autism and cannabis or CBD was really scarce or non-existent. So then I was talking to a friend of mine in the University of California in San Diego, and he was also wondering about the effects of cannabis. And sometime later, he started to study a product in his lab with his mini brain model of studying drugs in the brain. It's a replication of the human brain. It's a pea-sized brain, let's say. And he was obtaining very nice results with CBD. I'm not authorized to disclose the results, but it was motivational to me to start using CBD oil, which was what he was studying in the lab with some patients. So interesting enough, we don't have much literature about cannabis and autism, and especially about cannabidiol and autism. When I say CBD, I'm sorry, it's cannabidiol for those not familiar with abbreviations. So this is back in November 2019, when I was in Portugal for a conference. If you this is a search engine for generally scientific literature. When you hit cannabidiol and autism, I had 14 results. So now, almost 7 months later, this is of today morning, 20 results. So we don't have those many studies, but I will try to show you that we can have results, and we can use CBD safely without waiting for perfect results. That's what I have seen in my practice. So then we started to dig for other studies. There are studies saying or showing that CBD can treat psychotic symptoms, further confirming the potential of CBD as an effective, safe, and well-tolerated antipsychotic compound, although we still need more randomized and more elaborate clinical trials to understand that. So more studies saying that CBD may be therapeutic to treat aggressive behavior, usually associated with psychiatry disorders. So with that in mind, they were not about autism, as you can see. They are about treating psychosis and aggressive behavior. And I started to use cannabidiol, CBD, for patients with very difficult cases. So I'm not using CBD to treat every child with autism that comes to the clinic for a number of reasons. Although in our two practices, we see over 700 autistic individuals regularly. I have nowadays about 35. I had 50. Some are not taken anymore. Some we lost in follow-up. But I would say for certain 35 individuals using regularly. And why only 35? First, because I was not authorized to prescribe cannabidiol to autism. So these patients, we had to prepare a detailed report to the sanitary agency, such as FDA in America. So we had to apply for the possibility of using CBD for those patients. So in that report, I would have to say the clinical condition, the severity of the clinical condition, and what we have tried before that. So other drugs, antipsychotics, antidepressants, anti-epileptic drugs, combination of these, and also side effects that were not allowing for the treatment anymore. So all this together, we would apply for a permission. So this is hard. So if a child comes with autism, it's okay, or a little agitated, never took any other medication, it's not addressing other issues such as sensory difficulties, I'm not allowed to prescribe CBD, you know. So that has changed recently in February, but February was like a summer vacation, and then in March it came the pandemic of COVID-19. So these patients are not benefiting from the new rules that they are not obliged to have that medical report anymore to be able to use cannabidiol. But anyways, it's also expensive medication for Brazil, and especially expensive supplement, let's say, and that's why many families cannot afford and cannot be able to try that kind of treatment. So also, this is newer, showing that oral cannabidiol in children with autism may treat related symptoms and comorbidities. This is a very nice study, but it's based also on reports of the families. We didn't have more neuropsychological scales or psychological scales usually used in that kind of research. To understand more of the outcome measures. So what you are trying really to measure as an outcome, what improvement in what kind of behavior. But as I told you previously, it's hard to have that perfect double-blind, randomized placebo study with so many variables evaluated and for a long period of time. So studies like that are under enrollment. So they're initiating and they are enrolling patients for those studies, and I hope they come with good news. So we also have to consider that autism spectrum disorder and cannabidiol. Have we seen this movie before? Because some people are reporting the effects as miraculous or unbelievable. I have to tell you for sure that for some of my patients, results were very, very impressive. But some children had no results at all. They stopped the treatment, not because of side effects, but because they could not evaluate beneficial or benefits, and they chose to stop the treatment because of the financial costs and the lack of results. But about for 80% of my patients, I see very good results, and some are very, very impressive that maybe a family would refer as miraculous. But still, we need to know what kind of symptoms will benefit from the use of CBD or other kind of CBD with THC or CBD by itself. We don't know yet. So will the selection of individuals who are candidates for this treatment be an important factor? By force of the characteristics of the patients I had, and all the necessary paperwork required by the authorities, the only patients I could treat were patients with very severe behavior disorders that did not respond to available medications. So I concentrated my practice with CBD on those individuals. So, and why did I choose cannabidiol and not cannabidiol and THC or not THC? Well, I chose to be, let's say, on the safe side because there are some issues related to THC. Some of these families, they already have psychiatric diagnosis in the family, schizophrenia, bipolar disorder. Some studies may associate THC with the development of these disorders when you have other cases in the family. So I chose to be evaluating, let's say, or to adopt, it's a better word, just one product. So cannabidiol, which seems to be safer, and we would be evaluating the results of cannabidiol only. Okay. So I will report some of my case studies. I also don't have. It's not. It's a case study. It's not a scientific study with all those variables, with all the neuropsychological testing, because I'm still not allowed to do so. I have some legal issues that we are dealing with our institutes, and they were not part of a research. They were desperate people coming to me, to my clinic, in search of an answer, in search of better days, in search of being able to get their children back to school, because some children were so agitated and aggressive they could not attend school anymore, taking their children back to therapy, because the treatment of autism is therapy, multidisciplinary therapy, and they were not allowed to take their children to therapy anymore because of aggressive behavior. The clinics could not comply with that, so children were staying at home. So I tried a measure for those desperate cases. So I have plenty of them. I'm going to describe just a few. This guy, very interesting results. He was a premature baby with a normal electroencephalogram, an EEG study, normal brain magnetic resonance imaging, nonverbal with severe sleep disturbances, agitation, and aggressiveness. Just as I told you, he could not go to school anymore. He had tried diet for 1 year with no results, gluten-free, casein-free. He had been on valproate, aripiprazole, clozapine, olanzapine. And when he came to me, he was with risperidone and quetiapine. We started CBD. The brand I used was One Pure CBD Endopure, the one that my friend in University of San Diego had referred to me. And I tried to stay or to keep with one kind of product, so I can know results. I have patients that come from other doctors. They are taking different brands, but most of my patients I try to have on one brand, so we can pinpoint effects and know what we are talking about. So his current dose is 300 milligrams per day. Aggressive behavior ceased completely. So for the family, it's a miracle. For us, it's a response that we don't know how to explain yet, as I'm going to talk about it later. Risperidone and quetiapine were successfully weaned. So a guy who had tried many antipsychotic drugs in the past and anticonvulsant drug in the past now was with CBD alone. Another guy that is verbal, but only for very basic needs. If he needs water or food or go out, he can express that. But generally, he doesn't talk. With very generalized aggressive behavior and self-injurious behavior, he broke his leg from jumping. He had previous antipsychotic medication and anti-epileptic medication as well. When he came to me, he was taking antidepressants and two kinds of antipsychotic drugs. We started CBD at only 25 milligrams per day. Now his current use is 250 milligrams per day. No aggressive behavior anymore. No longer on fluoxetine and pyriceazine, which old-style antipsychotic drug is being reduced to be removed definitely. When he came to me, he was using that already. Now a young adult, also with generalized aggressive behavior for no apparent reason, no antecedent behavior for that. Could not attend public places anymore, go out to a restaurant, mall, etc. Also was epileptic. The other children were not. Medication at first visit, really strong combination of 1, 2, 3, 4, 5, 6 medications. We started, I'm sorry. It's not going back. So we started CBD as well. I don't know if you are following me, but for some reason it's not coming back. It froze. So we also started CBD we could wean her off some of these drugs, and now, oops, she's only with risperidone. No, she's without any drugs now. I'm sorry. She lost 20 pounds because she was gaining weight, and she had great improvement in aggressive behavior and also language, attention, and cognition. The parents reported that now she's singing, she's happier. Another case, a younger guy, very hard in the office, always jumping up and down, and running and scratching and biting himself, biting his parents. His parents would start crying in the office. Really, very sad story. We had tried carbamazepine, which is an convulsive drug, aripiprazole, antipsychotic, and fluoxetine, antidepressant. He didn't respond to anything at all. He was not able to go to school anymore. He was not able to go to therapy anymore. Just 5 months on CBD. Now his current dose is 100 milligrams per day, which is 4 milligrams per kilo per day. Impressive reduction in aggressive behavior. Last time he went to the office, when I opened the door, he was sitting quietly in the reception room, something that was unimaginable in the past. So, and then we could remove fluoxetine, and he's still with carbamazepine and aripiprazole, 4 milligrams per day, which is a low dose. And we have some other cases. I don't know about time. I have a few other things to talk about, but this is a very severe young teenager. She had tried basically many drugs before. And off and on, she would have to go to the emergency room. An ambulance would have to come to her house, pick her up, and take her to the emergency room for intramuscular medication and IV medication, and she would be released later on that day or the next day. Now, 4 months on CBD, current dose 225 milligrams per day, no more ER visits. She's much better with her aggressive behavior, better communication, interaction, and better sleep as well. So I'm not sure if this video is going to play, but it's another patient of mine, very difficult to respond to medication. He's with his speech therapist. He's refusing to participate. And all of a sudden, you see his reaction. So he would do that several times. He was on medication as well, risperidone, and also an anti-epileptic drug because of these manifestations, although his EEG evaluations have always been normal. So we started him on CBD, and then it's him at the dentist. No sedation, nothing at all. Able to be in the dentist, which scares me, by the way. So it's a huge transformation. But what's going on for those who respond that well? I really don't know, So is it because of CBD has enhanced their immune system or has stabilized their immune system? Did they have any kind of immune inflammatory components to the autism? And now CBD is helping to regulate that. We really don't know the answer. Did they have like occult seizures that were happening at night, although their EEG studies repetitively were normal? I really don't know. So is it for the antipsychotic effect per se? Right. So, but they have been on several different kinds of antipsychotic medications without proper results. So we really don't know, and we need to know. We have other actions of cannabinoids beyond CB1, and CB2. We also have to understand better our endocannabinoids and how they work with environment, how they work with food presentation. We are starting to know that, and what's the interaction of that exogenous CBD on that presentation. This is a very interesting review study from neuropsychopharmacology reviews. So my idea is that until we have a basic genetic profile of these individuals, so what's their genetic workup? So how do they differ from each other? Some friends of mine consider that we may have 12 different kinds of autism spectrum disorders based on observational studies with over 50,000 individuals that have responded, families responded to questionnaires. This is from the Autism Research Institute in San Diego, California. So, but now we have those modern techniques. So this is just a gene list of genes involved in autism. This is from 2017. We had 78 genes. Now 2019, we have over 147. And now from January 2020, we now have 165 single genes involved and copy number variants. So what's the genetic workup of the child that responds as a miracle and the child that does not respond at all? I guess once we have that genetic print of those individuals, we'll be able to pinpoint which one are responders or not, right? I have some colleagues that study that very well. That's where it all started. Dr. Allison, that referred me to that particular idea and product. We wrote a chapter of a book together. So, and also one important issue, going back to that slides again, have you seen this movie before, is that some families are so desperate, they're starting to grow their cannabis, or they're starting to have artisanal cannabis. They're taking whatever is sold to them on the internet, on WhatsApp groups, that they say that there's a doctor in the group and a farmer, but we have no confirmation of that. They do consulting over the internet, but you never know if the guy on the other side is a health professional or not, and they decide if you're going to take THC or CBD or CBD and THC, and we don't know what these children, these families are offering their children, how they are wasting their money, what kind of scheme is that? So we have to be very careful about cannabis contaminants. So what kind of solvents are in that product? Microbes, pesticides. Maybe you're thinking you're doing good to your child, but you're intoxicating your child. And autistic individuals, they are very sensitive to chemicals in the environment. So solvents and pesticides would be a very bad idea, and microbes as well, as for anyone, So I'm very much worried about what is being offered to those families. So it's not miraculous. It can happen, especially in the cases I have with very aggressive behavior. But I'm not talking about that all of a sudden your child will start talking because she or he is taking cannabis or CBD or whatever. Still, it has to do with therapy, with treating comorbidities and addressing the more you can in terms of therapies. So also, I was in that meeting of the Child Neurology Society meeting a few months ago. They were talking about those artisanal cannabidiol compounds. We don't know how much is it to use in a day. We have many questions and very few answers. So we should be on the safe side. We have to know what drug interactions. We have to know how it impacts some special populations, lactating women, pregnant women, children. Also, that was in the conference, it's their opinion about, and THC in general. I have only used products that are CBD isolates with less than 0.3% of THC. So, but what my colleagues in that event from the Child Neurology Society said in their lecture is that it can be either neutral or proactive as an anti-seizure chemical. Liver issues, we have to follow those kids and teenagers with a liver function test. I have never had any problems with that. They are all doing fine. We must know drug-to-drug interactions, but there are some aspects of THC that we don't know yet, and I'm trying to be on the safe side, especially because many families have other relatives with psychiatric disorders as well. Again, that the same question again, as I told you, what I have in my clinic, I have individuals that I'm treating, I'm working on one part of the autism spectrum, that it's a comorbidity, in fact, which is aggressive behavior. And when we dealt with aggressive behavior, we had improvements in language and interaction in some cases. Some children with sleep disorder, in fact, I had just two who benefited in their sleep. Other children did not benefit in sleep. They also take melatonin most of the times, or magnesium supplements for sleep, and also sleep hygiene measures. So talking about those more perfect and more detailed studies, which is what we aim for, of course, we are facing difficult times when we need science to help us. This is one of them with just CBD. They are recruiting patients. It's a very well designed study with many psychological scales and all that, with immense and necessary exclusion criteria. So we have to know what individuals we are treating in that group. Because if you have a group of 30 individuals, 50 or 100, but they have different comorbidities, they have a different background, they are on different medications, you don't know what you are treating. This is basic, but sometimes it's not addressed, and in those early studies, not addressed indeed. So more exclusive criteria. This is on the internet. I can send to the organizers if asked. So this is another study design which is very well detailed, but it's with cannabis varying. It's CBGV, not CBD. It seems that we will have good results with cannabis varying as well. But the completion of the study that may be affected by the current pandemic is for September 2021. So so far, we don't have those very nice designed, well-detailed studies that we are in need of, but we have very good data from families. And how about placebo effect? Placebo effect is common in autism, but those families, I was not on the placebo effect myself, so I could notice very impressive changes in the office. The therapists would call me and, what's going on? It's a different child. So therapists notice it. The school teachers, that children that were not going to school anymore, and the family perception. So it's not only a placebo effect from the family. So we do have something there. We can have very good results. So we have to get better studies. But while we don't have the studies, I truly recommend that we work with CBD on these children and teenagers and young adults with comorbidities in autism spectrum disorders, especially when it has to do with aggressive behavior and agitation, especially aggressive behavior. Hyperactivity is not really my best results, but aggressive behavior as a whole, right? And talking about science can be wrong sometimes, right? So this is from The Lancet, a very prestigious and famous British journal of medicine. This sentence speaks for itself, right? Some studies, they try to find fashionable trends. So there are conflicts of interests, invalid analysis, and science has taken a turn towards darkness. We have to consider that. So meanwhile, one aspect that I forgot is that most of these studies, they will follow children for 1 month. So they start maybe with a higher dose, 10 milligrams per kilo. I don't have any patients on 10 milligrams per kilo. Those that are taking 300 milligrams per day, but they weigh 60, 70 kilos, 80 kilos, because they have had antipsychotics that really made them gain a lot of weight. So I've been dealing with patients that are taking now CBD for 1 year, 5 months, 6 months, 7 months. So we don't have that in studies. So I have had no side effects that precluded the treatment. Results kept on going and improving. Those adjustments to get to the perfect dose takes some time in my experience. And some of these studies, they don't allow the necessary time to get proper adjustment of doses. So that's the dosage of the study. It's not that family is complaining, okay, let's have more drops a day or lesser drops a day. It's on 15 drops a day, so let's go to 17, 13. That fine adjustment we don't see in the studies. It's yes or no. It's 100 milligrams per day or 200 milligrams per day or 400 milligrams per day. And generally, they are evaluated on a short time basis, because studies are like that, you know. So they will be followed for 2 months, 3 months. One child that I reported, the youngest in that series, 7 years old, that I reported today, he didn't show improvement during the first month or maybe for 40 or 50 days. Then he started to improve with those adjustments. But why don't I start with a higher dose? Because we can have side effects, gastrointestinal issues. So sleep, sedation, not really sedation, but the child is more sleepy. And those parents, they're so tired of trying medications and have unwanted side effects that once you have like a tiny little effect, again, they will stop the medication. So that's why I start with small dosages and then work on that. And why these children, most of them are taking 2.5 to 5 milligrams per kilo per day. This is a nice sentence from a colleague of mine, a pediatric neurologist, Dr. Marta, that regardless of our background of genetics, environment, metabolism, hormones, it's not a done deal. It's not a story with an end. What's going to happen with your child or your teenager or your friend with autism, any other issue related to the development of the nervous system depends on what you do afterwards, right? So you can aggravate the condition, but you can also improve the condition. And CBD seems to be a promising alternative or additive to improving the situation. Now, we have been talking about science, my experience, which is really nice because it's a nice number of patients for a long time, but it's not really scientific because I don't have tests for outcome measures. All I have the reports of the families, teachers, therapists, and myself, which is not that bad either. But we have to think more when we are talking about science. We have to stop to think to promote scientific creativity, because I see lack of that in the studies today. They are not flexible. They don't consider other variables. This is also very old, 1990. But do we need more inspiration or perspiration? Most people are on perspiration alone, but we need inspiration in science as well. And this, an image from Charles Darwin, engaging in one of the lost arts of today. Yeah? I'm sorry, almost lost art of today in science, thinking. We need more thinking in science. We need to be more open-minded. CBD is not miraculous. It can be uh, evaluated like that for some families because results can be very impressive in a week's time, but it's not that families should do anything to get whatever kind of product without proper contamination issues and microbiological issues really clarified and concentration and so on. And also, as it's an expensive product, some families will stop paying the therapies, so they will abandon therapies to use CBD, which doesn't make any sense at all because the basics is therapy. And I've been trying to think. I have my problems, I have issues, I'm still learning. And to end up this presentation, this is a picture of the place where I lived for 23 years, walking back and forth at that beach almost every day, and it really helped me think. So I hope my presentation also is an eye-opener for some of you, and I hope that in the short and in the middle run, we can have answers to all kinds of questions related to cannabis and autism. Thank you.
Thank you so much, Dr. Mauro. It was a very insightful presentation. I remind our audience that you can ask questions to Dr. Mauro on the website Slido. You just go to slido.com and insert the code PTMC, and then you can ask the questions to Dr. Mauro. Dr. Mauro, we have a question from Nabila Chafi, and she asks if could the results be impacted by the type of chemovar used? What do you think?
The kind of?
Of chemovar. The chemovar of cannabis that you use to treat?
Okay. Yeah, we hardly have any strong data as related to cannabidiol. So I'm really not sure if it may be impacted, but we don't have any data on that. It would be speculation, right? So because as I showed you, we have very limited studies, and the studies only address the common, let's say, products that companies have, the companies that are available in my market, which is CBD One Pure. I have been using. Some other patients were on Revivit, which is another brand. I don't have patients on Charlotte, which is also available in Brazil. So I'm not the really good guy to answer those questions, but it's a very interesting question that needs to be addressed as well.
What about the entourage effect on clinical trials? Do you have any information?
Yeah, the entourage effect is not being used in any of those clinical trials or those big clinical trials that are enrolling patients so far. They are using really very specific cannabinoids, either cannabidiol, cannabidiol. That's as far as I know, these are the products that are being studied so far. So it would be a nice alternative as well, but in terms of science, the product would have to be digested in terms of ingredients, so we would really know what patients are taking, you know.
Okay, thank you. We have another question from someone that didn't state the name. Aren't the side effects of CBD negligible compared to the side effects of all the medications you mentioned in your case studies?
Yeah, sure. I can answer for sure. I had no problems with side effects at all. Somnolence or more sleep was observed in a very few cases. Then we could reduce the dosage, which I start in a very low dosage, by the way, to increment because I don't want to use a high dosage, which can have side effects and will be very expensive for the family to afford. So we try to use minimum doses and work on that. But no problem with liver function tests and no other problem described by the families. I have like two teenagers that they referred like sexual arousal, but we cannot really be sure if it coincides with the usage of CBD because they were teenagers, they had their hormones, and they continued to use CBD, and it didn't aggravate, and it's okay now. It's amendable.
Dr. Mauro, I was curious about the effects on the patients that you have been treating. What are the most impressive changes on their behaviors that you can share with us?
Yeah, the most impressive changes is that they were really aggressive. I apologize for the limitations because it's not really a study. It's observations from an experienced physician that was never like, wow, with drugs. So a few of these patients make me say wow to myself. So because it's hard to treat very aggressive behavior. Doctors who deal with that know what I'm talking about because we start one of those traditional drugs, then you go with higher doses, you have bad side effects, then you reduce the dosage, you start another dosage, then the family gives up you and they go to another doctor because they do like a doctor shopping. It's natural, it's not criticism. They look for another professional that then adds another drug, and then they go to a third or fourth professional, and sometimes they come back to you. And then they are on 5 or 6 different drugs, or they are on only 3, but they have tried others that failed. So side effects can be a big issue, especially with sedation and especially with weight gain. And then weight gain, you are prompt to diabetes and problems with cholesterol and all that. And in those patients, besides the lack of side effects, the change in behavior was very impressive. You know, so one of those mentioned the 12-year-old guy that broke his leg. He would have to come to the office. His mother driving, and 2 other parents, his father and or a relative or a friend, to take care of him in the back seat. Last time she came, it was just she and him. You know, she was driving and he was okay, sitting next to her. It's a 60-kilometer drive to my office. She lives in the outskirts here. So this is very impressive. So how does placebo effect explain that? So generally, all of a sudden, he would start kicking the sides of the car or the window, or sometimes biting her on the back, and nothing happened at all. This is very impressive.
Also, Dr. Mauro, you told on your presentation the importance of nutrition. How does food affect autistic kids?
Yeah, so this is also very controversial. Some autistic children, they need to be on a diet. Generally, it's an elimination diet. It's gluten-free, casein-free, and soy-free most of the times. So, but that does not apply to all individuals with autism. I have children with autism that have been on diets for a year or over a year without any results at all. Only the constraints of having to implement a diet, which is hard every day because it's gluten-free. It's not to reduce gluten. It's not like salt to a person with hypertension. You have less salt or less sugar to diabetes. No, it's zero. It's zero gluten, zero casein, zero soy. This is very difficult because children have to go to parties. Children have friends out at school that are eating a cookie, so they are trying to get that cookie from the friends. So this is a very good question. So some children will benefit and some children will not benefit at all. But for children with gastrointestinal or GI complaints, such as bloating, the stools, some days they are very soft, other days they are very hard. You have undigested foods in their stools, and some of them, they are kind of always biting the shirts or hitting the chest or the stomach or lying on a surface such as the arm of a sofa or a ball. These are indications of gastrointestinal issues, and if they are not properly addressed with a proper pediatrician or a gastroenterologist, no matter what you do, you will not get the best results. So these children will not do well at school, they will not do well in therapy, they will not respond to medication because they have an important comorbidity that people are just forgetting. Oh, he's biting his shirt because he's autistic. He's hitting his chest because he's autistic. No, he may have reflux. Everything may be burning. He may have a sleep disorder because of reflux at night, and it's impossible to sleep with reflux. But he cannot communicate. Hey, mother, I'm having reflux. Do you have a tablet for me? So it's important. It's important to be addressed if the child really needs. It cannot be neglected, but it's not an overall, it's not a universal prescription. Being autistic equals being on a diet. That's not the case, in my opinion, and experts' opinion as well.
Okay, thank you so much, Dr. Mauro, for sharing with us your knowledge. We hope to get back to you very soon, and that we can still talk about cannabis in autism, and that the research will go forward. Thank you so much as well for your work and for sharing it with us. Thanks.
Okay, I thank you for the opportunity, and I apologize for the stuttering sometimes because I'm not used to talk to a screen. I love people. I get really excited when I can talk to people, full audience, it's the energy, but I really try to do my best today. Okay?
Next time, and after this coronavirus situation, we promise we will be physically present, all of us.
All right.
Okay.
So thank you. You all take care. And I hope we can overcome this very dramatic pandemic really soon. Thank you and be safe, you all.
You too. Thank you. Bye-bye.